Hello and welcome to the Wellness Dojo podcast, where we bring real solutions to real health and wellness problems. On today's episode, we have the whole Wellness Dojo gang with us today. We have Tennille and we have Taylor, and they are both registered massage therapists with varied backgrounds in things like nursing and even traditional Chinese medicine. We get into some great topics around nutrition, genetics, and massage. Let's get into it. All right. Here we go. We're live for another episode of the Wellness Dojo podcast. And look who we have with us today. It's the team members of the Wellness Dojo. Woo-hoo. Isn't that cool?
Hello.
All right. So, care to introduce yourselves nice and quick here?
Well, I'm Taylor. I'm the RMT with Wellness Dojo. I've been with Kyle since, how long has it been?
It's been, I think, almost 2 years now.
2 years.
Yeah, I think almost 2 years, yeah.
Awesome. Welcome. And RMT being registered massage therapist.
I'm Tennille. I'm also an RMT. I've been with the team since, I guess, June or so. So only a few months.
Yeah.
Mm-hmm.
Good. So we've got some questions. As you probably know if you're following the Wellness Dojo, Kyle's quite active on social media, and he's got a few groups and pages that he runs. And so he asked some questions, or his question was, what are your questions? So
yeah.
he looked for feedback for questions for the team. And yeah, we got some interesting ones. I was taking a sneak peek at the list there leading up to this. And
You peaked?
I did. Yeah, just a little bit. I like to be prepared, but not too prepared. There's a fine line there.
There is a fine line, absolutely.
So, so we're going to go through some of those, we'll call them listener questions.
Yeah.
And
Fan questions.
Yeah, there
Like
we go.
fans.
Thanks. That makes us all feel better. We've got some questions from the fans out there.
Yeah, we've got
some fan mail.
Some fan mail. We've got some good questions. We have some questions that are specifically for RMTs. We've got questions that we can all answer, and there's even some questions specifically for you, Dr. Riley.
Ooh, okay.
So you guys want to get right into it?
Yeah.
Sure.
Okay. So first question, and we're starting off with one that I will not be able to answer very much. I have a lot of experience dealing with this type of thing, but I don't have a lot of knowledge around the actual thing. But histamine intolerance in food, what causes it, and is there anything that can be done to reverse it or improve immunity too?
Well, I know that Tennille's been looking into this a little bit.
Oh, you're going to throw it off to Tennille right away? Okay.
Maybe, just right before, I'll just say, like, sometimes we hear about histamine, but we don't really know what it is or what kind of a reaction it induces. So it's you can think of it simply as like your classic allergic reaction, nondescript kind of allergic reaction where you're talking about things on your skin like hives or reddening of the skin, feelings of itchiness, maybe a change in your breathing because there's a little bit of inflammation and swelling. So that's histamine reaction. So the question is histamine intolerance in food, meaning, so there are foods that are high histamine. So if someone's intolerant to that, they're going to be intolerant to a lot of healthy foods, unfortunately, are on the list. And a lot of, there's like hidden kind of histamine foods that maybe people aren't aware of. And so you're reacting to this and they're saying, what the heck can I do? Is there anything that can be done? That's the first question.
Yeah.
Yeah.
Right.
And solving the world's problems is Tennille.
This is Tennille.
All right. So yeah, just like Dr. Riley said, the histamine intolerance can be an inflammatory process. So, it doesn't necessarily mean that the food in general is causing that intolerance. It could be our gut is inflamed. Since our gut is inflamed, then some proteins or anything can just leak through the gut and come into our bloodstream or somewhere it really shouldn't belong, and just creates that big inflammatory process.
Yeah, and
So-
when you mentioned the gaps there, you're talking about the actual gaps in between our intestinal cells.
Right.
And that was something that I wasn't quite sure about. I was like, is that real? Is that really happening? And it is. Like, that has been studied specifically for things like gluten and even dairy can increase those gap junctions. And then there's certain things that you can eat to tighten them as well. So I like what you said, though. It's like, it might not just be an issue with these specific foods. Like, the body's sending some sort of a signal to you.
Right.
It's unhappy in some sort of way. And to me, the histamine thing, it's like it's almost tantamount to a hypersensitivity. So then why are you hypersensitive? And you could be hypersensitive because of you have a lot of oxidative stress on your body. And I mean like real oxidative stress, like you grew up near a gas plant or you grew up in a house that was built in a time where, you know, there was asbestos and there can be mold and things like that. And you have to, especially for the whole like metal toxicity thing, you have to kind of be tested for. But that's, so I'm always like, yeah, but why is it? Why are you overly sensitive? Why is it overreacting? When did this happen? Did it happen since you were a kid? Well, that's different than it happened with someone going through a divorce or something. It's like, then it's, you know, then it's stress related, right? And so
yeah, and that's the case, you know, like, and a lot of our culture's diet these days, you know, is inflamed. So alcohol, unfortunately, has a lot of triggers for inflammatory process, and it actually lowers some of our enzymes. One of the enzymes that lowers histamine is affected by certain dietary additions like polyunsaturated fatty acids, like, you know, those PUFAs. You know, we do need things like that in our diet, but these days we have a little bit too much. So usually for like PUFAs, we say 1 to 2% in our diet, and we have around 20% in our diet right now. So those just create that inflammatory process in the body, which can stimulate the histamine. So it's not necessarily...
Yeah, sorry, I didn't mean to cut you off.
No.
I was just going to say, like, I know for somebody who might be asking a question like this too, I think it can be really frustrating for them because they are so confused because it could be so many different things, right? Totally. So do you guys have any advice for people on like, how do we start to narrow that down and just like kind of get to some line of answering for them? Is it testing? What is it for them?
Well, they're probably aware of most of the foods that they react to. I like what you mentioned about the enzyme, because there's certain things, even things that are healthy, like green tea, that can inhibit that enzyme, making the histamine reaction worse. So I guess for myself, it would be looking at foundations of health. What can we do first and foremost? And there's a lot that you can do through diet to make sure that the body isn't under that oxidative stress, and then sleep and all that stuff. But then it's like, if they're doing everything correctly and they're still having this reaction, then I would move to maybe some more particular testing.
Is it like food elimination dieting, that kind of
thing? As far as a solution, you can do that. Yeah. Have either of you done an Elim diet or anything like that? Okay, well, then let us know about your experience with that, because that would be something that you could do in this case.
Sorry. Well, mine is I'm sensitive to gluten and dairy, and they kind of go very hand in hand for those reasons. So I cut them out, and I was having eczema, all kinds of things, and it was showing up physically. So I cut those out, and I'm having much better issues, like not those issues. So yeah.
How long did you do like a strict Elim diet for a month or something?
So gluten I like slowed down and then I cut it out. Yeah. But I've been off of it now for six months.
Oh, congratulations.
Yeah.
Nice.
Yeah, it's good.
I didn't know that.
You have to have like a 1-year birthday party for it.
Honestly.
Yeah. Just eat like all the gluten. Just feel like crap. Are we okay if we move on to the next question here?
I'll say so an Elim diet is something that you can do, and then you can reintroduce food back in, but you push the gas pedal on that food pretty hard for 1 to 3 days to see. Eczema is a little bit tougher because you might not have a flare up. So if I do cheat, which I've done it a few times, and it's like instantly I will get a reaction. So the next day I'm super bloated and I'll break out like crazy. Yeah, and what a great piece of information that you got from it, and now it's undeniable. And I've found that with people too, and then the negotiation process can start where it's like, okay, I know that I'm sensitive to this. I know it harms my symptoms, but I've got Christmas dinner coming up, and like, happens. Can I do this a little bit and have a dinner roll and have a bit of gluten? Yeah. Well, that's good advice too, that you typically always regret it. And the next day, if you avoid it, you typically never regret avoiding it. You're like, thank you, past self, for doing that.
Okay, we're going to go on to the next question. It sounds like histamine could be like a full episode in itself.
And reishi mushroom might help long term regulate the immune reaction.
Okay.
Yeah.
Interesting. Okay. Next question for the RMTs. Is there such thing as too much pressure, or should one take as much as they can stand? Taylor, you have the mic first, so we'll throw that to you first.
So definitely there is such thing as too much pressure. someone should always be able to breathe normally during a massage. With that being said, though, there's different treatments. So if I were to do something like treat tendinosis, which is like tennis elbow, for instance, I'm going to be doing something called cross fiber friction, which is going to be very uncomfortable. But the idea is I want to inflame the actual spot. I want to promote inflammation for it to heal. So in that, yes, there's too much pressure, but it's what you're treating. So also, as a massage therapist, like the tissue will react to my touch. So if I'm going in too deep, it's going to bounce back right away. So you got to warm it up.
You're going to feel a reaction from it.
Yeah.
I know one thing, we'll throw it to Tennille. I know one thing that I've always done is I'll talk to my clients while I'm increasing pressure just to kind of gauge that. Because there's a lot of times where people are like, nope, you go as hard as you can. And like everybody's had that client, right? And
I'm that client.
They just want to be tough. I've had my share of guys come in, especially, who are like, nope, just go as hard as you can and stuff. And I'm like, you start giving some pressure and you start to realize, like, yeah, their body responds much different. Like everybody's a little bit different. So yeah. Right.
There's that long time saying, no pain, no gain.
Yeah.
And I think that's what a lot of people come into massage with. Now, we can do deep tissue, but since we know how the body works in the muscle tissue, sometimes it's not for just deep, sometimes, touch like lymphatic drainage, you barely touch the skin, but it is such a good process for healing. So, deep, it has its, there's time for deep, time for light touch. So it is up to the individual, but I think it's also up to the therapist, and we could work together that way.
Yeah, it all comes down to communication, like anything else. We just have to talk to those clients and try and gauge their reaction, and then just kind of go from there.
Right.
Like I've had people where like I can tell that they can't take that pressure, they're trying to, and then afterward they're like, yeah, it could have been deeper. I'm like, no, couldn't have.
Right.
You would have responded like really bad if it was. And like you said too, it depends on the state as well. Like if you have an acute injury, then you don't want to go in and start, like if you just had a muscle tear, you don't want to go in there and start digging super deep. You need to, be getting rid of inflammation, which is a much lighter treatment, right?
And like Taylor said, like being able to work with the breath is really important. And, you can go nice and deep with that, but you have to be able to breathe through it.
If you can't breathe, you're not.
I like that marker. Yeah. If you have to be able to breathe. That's as the patient, right? And you too. Yeah. You have to be able to breathe. You can't just be like.
Yeah. You see it when you see that hamstring activate and the knee bends, you're going a little bit too deep.
Exactly. Yeah.
Yeah. Anything else that we wanted to add to that one?
Yeah, I was just gonna say, like, for those people out there like me that think it's always just got to be 100%, like, especially the athletes, because they're used to that type of mindset from their coaches and all that stuff. Just think about everything in the world, anything that you do to your body. It's like there's always this point where you can take too much melatonin, have too much fiber in your diet, exercise too much. Like there's always this point of diminishing returns. It just seems to be like a universal law. So it's not surprising that massage is the same way, right? I cringe at what I used to do to my body, like trying to roll. I would roll out on a golf ball in my shoulder blade. I think all I was doing was just pressing and stretching nerves and getting different sensation in my nerves and being like, oh, it's working. But that was before, this is like 10 years ago. Yeah. This is before I had any knowledge about the body and the nervous system and what's actually going on. But I would do some horrible, and like I wasn't thinking there's nerves, there's arteries and stuff. I'm just like, yeah, get the golf ball in the quad. Like,
Yeah.
Yeah. So yeah, it can get pretty rough. And I imagine the same thing with acupuncture too, right? It's like there's a level of pain that you want people to be hitting and not hitting.
Oh yeah.
Before treatment is ineffective.
Acupuncture should be painful.
Yeah.
Yeah. And I mean, Taylor can talk about that too.
Yeah.
Yeah.
Yeah, it depends on what kind of treatment you're doing. If you're doing e-stim or something, you want to feel that muscle jump and you want to feel like something's happening, but you don't want it to be like excruciating.
Yeah.
Because it's working on the nervous system. So if you're like tense, nothing's going to relax.
Yeah, I've been doing a lot of just gentle electrostim in my treatments.
And for those of you who are listening and maybe don't know what that is, do you want to explain that real quick?
So it's the electric current that we attach to the needles and we're trying to initiate some like the pulse to go through the muscle essentially.
Yeah.
It's like trying to get the muscle back into like a regular rhythm is how I've heard of it. Yeah.
Like realign those muscle fibers a little bit, kind of like how we do with massage. It's similar idea.
Yeah. I like
It's
that
like
thought.
it's like when you have pain somewhere, you just like slap it. Just it's kind of like that a little bit.
Yeah. Save yourself the acupuncture fee and just slap your muscles.
Yeah. maybe elect for the acupuncture. We're gonna jump on to the next question here. Hopefully that answered their question. I think it did.
About smacking muscles.
About smacking muscles. Yeah, we kind of went a little bit off on a tangent there. Okay, guys, what are your thoughts on genetic testing for diseases? I've heard pros and cons. Pros would be being able to adjust your lifestyle to prevent possible diseases, and cons being increased anxiety worrying about it, for example. So I think they're saying, what are the pros and cons to kind of like testing for these diseases and knowing that, I think they're talking about like that you're more perceptible to certain diseases. Like, there's those testing that says like you're this likely to have Alzheimer's, that type of thing. That could bring a level of anxiety, or is it better to know that going in? And it's kind of like that old question. It's kind of like that old question of like, would you like to know the exact date of when you're going to die, or would you rather just like wait and see? It's kind of like that kind of question. So what do you guys think about that?
I'm watching an anime called Death Note on Netflix, and one of the things they can do is they can see people's like name and expiry date. So yeah, I wouldn't want to have that power. Back to the question.
I was gonna interrupt and go on my own tangent. My wife watches Outlander. For those of you who watch Outlander, did you guys watch that one? Okay, you do. So she goes back in time basically, so she knows like the events of what happens to these people. And that would be a kind of a scary thing.
Yeah, I think. No doubt. Okay.
Sorry, back to the question.
Have either of you done genetic testing for yourselves?
I haven't done it, but mine was because mine's for cancer too. So they gave me the option, but for me, that's where like the whole life insurance comes into play. So I don't
disclosing things, maybe.
Exactly, because that was so. That's where I'm like, I don't want to, because I don't want my future life insurance to go up.
I think that's an angle a lot of people wouldn't think about.
What an angle.
Yeah.
Yep.
Oof.
Tennille, have you had any of that done? I've never either.
I've never done genetic testing. No. But, I think talking about genetics, a lot of it is stemmed from that, but it's not necessarily, it's just in our cells and we're going to have it happen. Sometimes it can just be through learned trauma or learned, dietary preferences, how we live our life. So, it's just when you talk about genetics, and I think a lot of people might look at that and say, okay, I'm definitely predisposed, and they can't change anything about it. But I think, a positive thing about that is we can do a lot of positive, we can have an impact on it just by changing our mindset or changing our diet, changing our lifestyle. Now predisposition is a thing, but I think we have a lot of power in ourselves. So
for me, it always comes back to like focus on what you can control, because whether, if I'm going to get this disease no matter what, then at least I can put myself in the best position possible and do the things that I feel are best for me in order to give myself the best chance of being healthy. There's always going to be things that we can't control, and that, you hear stories about people who live extremely healthy lifestyles and still die of a heart attack and these types of things. Like, life is going to happen. Put yourself in the best position to succeed as possible.
Yeah. And then don't worry beyond that.
Right.
Yeah.
I do like the angle of not worrying and having anxiety about it. But I think that it's my opinion is it's always better to know. And I think that you'll be surprised that even if you have a 500% chance increase on your genetic test, what that might mean is that the regular population has a 1% chance. And now you've gone up to a 5% chance. So you still have a 95% chance that it won't happen. Yeah. And that's really, really good odds. We live our life like that all the time to things that we're not even aware of, that we're going, driving our car. It's, it's a 90+% chance. Yeah. But so we live our life like that. We live it fine. And so that, like, that figure is that's called absolute risk, is the small one, but that's the one you need to, it's like, I have a 2% absolute risk of getting this with my genes. But the one that is out there, like in your face and in marketing, that we saw a lot during the pandemic, the big numbers, it decreases this 80%, increases this 200. That's called relative, but and that's kind of the flashy number. But what's really important is that baseline. And so even knowing, I love your, like, I don't want to do it for life insurance. Cool. Okay. Other than that, I think it's really good to know, because it's you're running towards the truth instead of away from it. And I always think you should, as hard as it is, try to run towards the truth.
Yeah.
I had to do this. And you mentioned Alzheimer's recently. I had to do one for that because my mom's mom died of it, and it was pretty frightening, and and all sorts of things, sad, horrific, like all these things. And so I did the testing for that. And when you do it online, the way I did it, there's like this reveal, like click here to reveal. And I clicked there, and a doctor on the video popped up explaining it again. And then it was like, okay, are you sure you want to know your results? And I had to like get up and walk around the room and psych myself up. And then I opened them up, and I misinterpreted them. And for the next hour, laid on the couch going, I'm going to get Alzheimer's. This was also a long time ago.
Yeah.
And so I've experienced this, and I was like, oh, life's going to be different for me. Oh my goodness. Do I only just have 50 more years left before this kicks in? Like, what does this look like? And then I realized I misread it, that this certain variant, the ApoE variant, was a pretty low chance for Alzheimer's. And I was just seeing I got the variant. And that's kind of the danger of doing it without any guidance.
We're going to have to bleep that word out.
Yeah. Oh yeah, you're right. Yeah. So anyway, I'll take that position, that run towards the truth. It's good to know, but even when you know, it's like, then you have to put it into context. Yeah, but how much more is a 300% increase over the general population might still be less, only a couple percentage points overall, and it's like you still have a 97% chance of not getting it. So
yeah, you have to be practical about it. And I think the big risk too is, like, a lot of people want to find out, and then when they do find out, like, oh, I'm more perceptible to cancer or whatever. Now they like attach themselves to it, and they're like, I'm destined to have cancer. And so then it's like, you're almost like putting it out to the universe now that this is me now. It's like, no, just now you take extra action, right? But I think what it's sounding like across the board is that it's kind of personal preference. Like, you got to really decide what's best for you and your, from the question, your anxiety level too. Like, if you have extreme health anxiety and stuff, then maybe you need to, you really have to question that and ask yourself, is it worth knowing? Do I have to know? And will it lessen my anxiety or increase my anxiety to know, right?
Yeah, and I think too, like, there's more conversations around metabolic health and metabolic diseases, and a lot of these things that we're talking about, Alzheimer's, diabetes, they can stem from these metabolic issues. So I think more of the conversation is getting around just it's genetics and I'm predisposed, and it's we can actually do something about our and our future health.
Yeah, well,
it's interesting, all that new information that's coming out.
The fascinating thing is that we're learning that we can actually like change our genetics through our lifestyles and stuff like that, right? So the Dutch famine studies, that was so cool. I might have mentioned this already, but just measuring the stress response in adults that were gestated during the famine in periods of high stress for the mother, and they have an amplified stress response later in life compared to someone, and this was across the board, just a couple generations later, that there was food again and the moms weren't stressed out. And so that's an example of what the mom's going through, her genetics kind of changing and passing it on to the child in one singular lifetime. So it does happen. Yeah. It'll be interesting to see
more pressure on you parents to be perfect.
It'll be interesting to see what that looks like, after the last 2-3 years that we've had now too, because it's been a very high stress, high anxiety kind of couple of years. Be interesting to see what that looks like for us too.
Yeah.
This next question kind of plays into this question as well. It's a different question, but very similar. What role, if any, do genetics play in the ability to achieve and maintain weight loss? Does anybody want to take that one first?
I think that when we talk about genetics a lot, when you see a heavy parent and a heavy child or something like that, I believe that you're either seeing one of two things. One is a genuine genetic dysfunction, like in thyroid health, and the other is probably more so that you're copying what your parents did than you realize in their eating habits, their relationship with food, exercise habits, all sorts of things. And I think that people are actually, with the exception of the actual genetic deficient, I think people are less genetically determined and destined to be than they think. I think they're thinking it's an 80%, and I'm thinking, I don't know, 15 or something like that. Yeah.
And sometimes, like, touching on just the family history and stuff, like, it's, if somebody does come from a learned family of sedentary lifestyle, so like not moving very much, it's not that really we're over fat. I think a lot of us are under muscle, because our muscles have a huge metabolic importance in our body, as well as immune function and everything, just because of the way they function. So, it's for weight loss, maybe it's not necessarily losing the fat, it's gaining the muscle, and things kind of come and meet in the middle somewhere. So I think too, like, just centered around this question, I think oftentimes if you find yourself, like, let's say your parents were obese and your grandparents were obese, and now you're obese, or now you struggle with your weight and that type of thing, it's very easy to look at that and go like, oh, it's just because of my upbringing, or it's just because of this. But people often don't look at the fact that, like, they can still change their habits. Like look at how the habits that your parents and your grandparents had. Yeah, we lived through different times, but the habits that you have, a lot of the times they're the same habits that your parents had. You'll catch yourself as you grow older, especially when you have kids and stuff. Like, I notice it all the time now, where I'll do something, I'm like, oh, I sounded just like my dad, or like, I'll notice like something that I do where I'm like, oh, I noticed that, like, my mom does that, or my grandpa did that, or something. Those things are so ingrained in us from so early on in life, that if that's something that you're struggling with, like, I really urge people to take a really good look at your habits and your lifestyle and see what habits could you change away from what your parents had that might put you in a better position to not be obese.
I think that's where, like, the, like, almost traumatized little child comes in sometimes. Like those people that don't heal themselves, it trickles down into your kids, and it goes over and over again. So if your mom struggles with eating, you're going to watch that as a little girl, and you're going to be like, oh, that's a normal relationship with food. But if you don't heal that, it goes down into generations.
Well, we're seeing it now in studies that trauma does get passed down genetically, right? So it's like you said, maybe it's not the fact that you're destined to be obese, but maybe it's just the fact that there's trauma that isn't yours that you're holding now.
Yeah. And that's why I'm always holding out hope that it's probably less preordained than you think it is. Yeah. And I just kind of gave those were just kind of loose numbers. Those weren't based on research about where I think, the amount of effect that genetics might have on you. But the reason I guessed it to be pretty low is because we've all seen those people that for decades of their life, they seemed to be the person that was preordained to be heavy and not lose weight. And they would even joke about it, and that's just that person in your friends group or in your family, and then they get their shit together and lose 80 pounds. Yep. And we've all seen that, and and then once they've done it once, there's at least evidence that it can be done again. It's really hard to keep it off, but
and what you just said too, I think that's what happens is people think that once I achieve this weight or once I achieve this goal, I'm good, and then they have maybe like a 2-year pandemic that sets them back 2 years, and then they think like, oh, I'm just destined to be just like my parents were. It's like, no, remember what you did before, right? Like, you have to remember what you're capable of, or start to believe what you're capable of, and see that it doesn't have to be that way. Again, it's take control, right? Sure, maybe you are more because of your genetics, maybe you are more likely to hold more weight. You can still put yourself in a better position to be healthy.
Right. And I think, like, a lot of time weight loss is for the physical body. And like Taylor touched on, sometimes it is with the spiritual, sometimes we have to heal within to be able to heal on the outside. So
Yeah, I would say almost always.
Yeah, it's probably one of the biggest factors, I would say, to keep it, like, to have that sustainability in it.
And I mentioned
Longevity.
this once before on the podcast, and it's a bit of a dive, so I won't go into it too far, but that fat, that adiposity can in the physical realm can actually act as a padding or a protection to the mental emotional realm too. Yeah. And it can kind of be a subconscious thing because it is protection and it is stored energy and it's some security. And so I won't get into who I heard that from or how that came up, but when I heard that idea, something clicked with some clients that I was working with as well.
I'll just touch on, in Chinese medicine, they call it phlegm. So phlegm essentially can be something we call, like, someone looks like they're holding more adipose tissue, but it also can affect the mind. So phlegm it's like a fog you're almost walking in. So if you have more adipose tissue, it goes to the brain and they call it phlegm. And it's like you're walking in a haze all the time. But yeah, it's crazy.
And is it right to say that you're studying to be a TCM doctor?
Yes.
That's the correct term?
Yeah.
Awesome. Yeah. Is it also called dampness?
Yes.
Okay.
Yeah.
Nice.
Phlegm, dampness.
Yeah.
All that lovely stuff.
Yeah, you're right. And it's holding on to things. And that's what Chinese medicine does so elegantly, is it blends the physical and the mental emotional as if, like, of course you're holding on to something physical because you haven't learned to let go of the thing emotional that you're holding on to. And, like, to people in the West, with what I just said, for some people, the light bulb just went off and they went, oh my God, I'm doing that.
It makes so much sense.
And other people go, what?
Because people don't want to open themselves up to that too, oftentimes, right? Like, getting vulnerable, and that's a whole other topic on its own, but really, like, getting vulnerable and trying to connect the spiritual and the physical, I'm a firm believer that unless you at least touch on both of those areas, it's always going to be so hard to see long-term results. Like, if you don't go under the surface, those physical results, they just won't last long-term. It's just too hard. All right, next question. We're going to move on. Okay, so this is... I
love the clipboard, by the way.
I know, thank you. Yeah,
this is
very professional today.
Yeah.
I didn't want to mix up anybody's questions.
Fair.
This is an easy one to read. Can you be too old for martial arts? So it's obviously a martial arts question, but I think we could relate this across to, like, any kind of new activity. As an older adult, can you be too old for these things?
I can still do karate chops in a hospital bed. You're never too old.
Like, you sit in a hospital bed. You're never too old or disabled.
I'll pass this on to someone else, though.
I feel like you could modify it. So even like something like Tai Chi, it's very martial arts like, but you're not making the impact. So there's modifications. Yeah.
I think it comes down to expectation, right? What expectation do you have for yourself going into it? If you set an expectation that's too high going into something, then you're probably going to be frustrated and disappointed. But, if you go into something and just, say, I'm just going to go and I'm going to enjoy just trying something new. Well, you're probably not going to be disappointed then, because you're going and you're trying something new. Mission accomplished. So look at the expectation that you have. And then with anything, even if you're just starting with weight training for, as an older adult, you've never weight trained before and you're starting, again, like, look at how you're starting. Like, don't jump in and be like, okay, I'm going to start with back squats. Like, no, maybe start with body weight squats. Maybe start with no weights. Maybe start with, the light weights, and then slowly build your way up. And I think if you do that, then I think you can do anything, no matter how old you are.
Well, exactly. That's what I was going to say. Like, you're never too old to move your body. And I think it's very important to do it in the appropriate manner. But go ahead, start.
Always love the term, if you're not moving, you're dying. Right? It's so true.
Move it or lose it.
Yeah, really. I worked in a seniors home for years and years. Like, I worked there when I was in high school. And then even when I first started as a massage therapist, I was working for a company that was, that's kind of what made me money for a little while, was going in and doing massage and exercises with seniors. And it was, like, heartbreaking to see what just sitting all day long does to somebody. Because you'd see somebody come in and they could walk on their own, and it was like sometimes only months after they were in there. Not to trash seniors homes, there's some good ones out there and stuff, but when you're sedentary all day, especially at an older age, like you have to force yourself to try and move your body in different ways. If that's martial arts and you're capable of that, fantastic. If it's not, like Riley said, you can sit in your chair and like just punch. Like that's gonna benefit you. It is.
Yeah. Just punch all those fears away.
Don't punch the nurses that come in though. Please leave the nurses alone. They're good people.
Punch the air.
All right, let's move on to the next question. Okay, so we're gonna go to, how does cupping help? So cupping therapy, how does it help people? And Taylor, do you want to take this one first?
Sure.
Yeah.
So cupping, essentially, so what I look at it is you're trying to move chi and blood throughout the body. So chi is pretty much the life force of the blood to go through the vessels. So if you have stagnated blood ever, there's going to be pain. So with cupping, you can kind of think of like a spider web, like a fancy new one. It's like all open, it looks nice. And then think of like a gross spider web in your great grandma's like basement. It's like all clumped together, not very pretty. So fascia is what we're targeting. So this tissue pretty much wraps around your muscles. So fascia that's not healthy will look like that old spider web. And so cupping goes in and it breaks up that fascial restriction. So that's the best way of putting it. And we're moving that blood back into the muscle.
You just had to use spiders.
Yeah.
Mm-hmm.
They'll remember it that way.
Now my heart rate's going? No.
Yeah.
And like you said, because the fascia encapsulates the muscle, if it's tense, then it's like wearing a straitjacket, and everything else is going to be tense. And that's maybe why deep tissue massage isn't always, like someone might think they need a deep, and it's just that their fascia is so tight and they don't know about fascia.
See, that's the best way too, is like if you start up with cupping and then you go deeper in with deep tissue, that's your best bet. But just going right in there, it's like almost like trying to like massage like a tube of like sausage, I guess. It will just like try to go out one way, but it's still closed. So it's it's not gonna be good. Yeah.
Love your analogies. The best.
Well, and the other way I kind of look at fascia is like a saran wrap around your body. And then for cupping, it is like a suction. So you cup, or like you put the cup on and it takes away those tissues. So it takes the superficial tissue away from the bottom tissue, and it just creates that space, creates a little bit of blood, inflammation, which inflammation is healing for our body. So creates minor tears and abrasions to break apart the bigger abrasion, in the fascia there. So
yeah, I think it's important for people to remember that everything in your body is connected, right? And that fascia is basically the connection between, your muscles, your skeletal system, and your skin, right? And so if that's tight and your muscles are being loosened up, if you don't address the fascia as well, it's still pulling on the muscles, it's still pulling on the skin, so everything's still going to slowly go back to that tension. The same way as you look at chiropractic and those types of things too. You adjust it. If the muscles are super tight, they're going to pull it back eventually, right? So we have to address kind of all these layers, which is really important.
I think too, even like fascia, they're doing studies now that it's even linked to like mental health too. So if your fascia is all restricted and that's from not moving or postural dysfunctions, anything, that fascia can tighten up. So again, the moving, not moving, so cupping increases that movement. Yeah.
Danielle, you brought up an interesting concept because we've been talking about how inflammation is, it's bad. We talked about it in the gut. You mentioned it, how inflammation and the TCM dampness might be connected. So, can you parse out a little bit about why inflammation equals bad sometimes and why inflammation equals good sometimes? Because that can be confusing.
So for why inflammation is good, it's promoting that body to heal. So if you cause inflammation
purposefully and in small doses.
Small doses, your body's going to send its energy there and it's going to want to heal.
Yeah. And it does. It sends, healing cells, white blood cells to the area. And it sends blood flow and it sends lymph and
all the good stuff.
Yeah, because it's coming to your rescue. So you're kind of leveraging these innate things that you have within you.
Right. And when we talk about like the negative aspects of inflammation, it's because it's usually uncontrolled. So it's just too much, it's like too much of a good thing almost. So small inflammation, that is, that we do as therapists, really good. But, things that we were talking about earlier for the histamine, that kind of inflammation does create, disease, basically. So
I think
there's good and bad for it, but
like you said, controlled inflammation.
Controlled, yeah.
Right. I think that's a good way for people to think about it, is like when you drink alcohol, it's not like you're not like purposely drinking alcohol so that you can create healthy inflammation in your body.
Right.
That's not like purposeful controlled inflammation. But when you're doing like frictioning and cupping and those types of things, that's controlled inflammation that's going to help your body help promote blood flow in that sense.
Are you saying you're against my alcohol-only treatment plan?
Yeah. I know it's
not doing so well with my patients. Maybe I gotta admit.
Yeah, that's maybe stay away from that one. Yeah.
The diet. That's the new diet fad.
That's the next diet
Yeah.
fad. Yeah, it's alcohol only diet. No, you did not hear that here.
It's coming, 2023.
2023.
Bit of a failure all around.
For some people, that was 2020. Yeah. Okay, let's jump to another question here, if you guys are good with that. How long should you wait to get a massage once you're injured?
Well, it definitely depends on the injury, and it will depend on the type of therapy that we do. Like, you can get a massage fairly quickly after, but it might be just like a superficial light massage, or I just focus on one aspect of the body. So that one is very situational, but you can get a massage fairly quickly after an injury. Yeah. I don't know if you have much more.
Yeah, no, for sure. That's the same. But yeah, like if it's an acute stage, if there's inflammation in that, we can do a bit of lymphatic drainage to help that swelling a little bit. But other than that, like, it is great to get a massage pretty quick after, get that blood flowing. We know how to manipulate the joints in a safe way and stuff like that. So always can help.
Yeah, and if you don't know, then ask.
Yeah.
Right? Like if you don't know if you should get a massage, like call wherever you're booking and ask them. Say, hey, I had to do that. Like when I had my concussion, I called Dr. Al. I was like, hey, like, what am I allowed to do right now? He's like, I'd never had that before. It was a new injury to me. I didn't know what I could and couldn't do. Same thing. Like if you break your leg or something, you're not sure, can I get my leg massage? Call and ask. Like they will tell you. We will tell you. Yeah.
Always here to help in the healing journey. So
that's the other thing I was going to add too, is that you can almost always get something done. Like you can almost get some form of massage, whether it's lymphatic drainage or whether you're working on muscles that are surrounding the injured area as well. That can often be very beneficial because you can help avoid compensation and just like tight muscles on one side from the injured side, that type of thing.
Yeah, I think the only time that it's a bit of a red flag is if you have like an MVA, so a motor vehicle accident or something. You have to get assessed by a GP or a chiropractor or a physio before. But once you're cleared, it's pretty much, whenever.
Yeah. All right. We nailed that question.
that
that was an easy one. All right. Thanks for that question. Okay, let's go. Okay. Can reverse dieting fix metabolism? I'll throw it to you first.
Reverse dieting?
Yeah.
So eating healthy again?
Reverse dieting, referring to that would be like people who are like, my metabolism is broken because I haven't been eating enough, and so you're slowly adding more calories into your diet versus reducing calories.
Yeah, absolutely. That can help. And the other thing with metabolism is there's an association with metabolism and cortisol as well. And once you start giving signals to your body of self-love through regular meals and meal planning and eating healthy things, that lowers that hormone level, which is also going to help support your metabolism in healthy ways. So yeah, absolutely.
I'd say the one thing that people need to be cautious of is that I would say a lot of the time, and I don't know if you see this as well, but for me, a lot of the time people come to me and they're like, I don't eat enough. Like I don't understand how I'm not losing weight because I'm only eating 1,000 calories a day. It's like when you really get honest and it sucks to say because you don't want to call people liars and stuff like that, but oftentimes we don't realize that we are in a calorie surplus when we think we're in a calorie deficit. Right? I've had so many people that are like, I eat 1,000 calories every single day. I'm like, what about the weekend? Well, I don't track on the weekend. Let's track the weekend. Let's see what that looks like. 4,000 calories a day on the weekend. You're in a calorie surplus now when you look at the week. It's a very it can be very defeating for people, and I've seen it where people come in and they're so defeated because they're like, I've tried everything and like I'm in a calorie deficit, and it's like we have to really make sure that you are in a calorie deficit before we blame the metabolism.
And it also depends what kind of calories you're eating.
Mm-hmm.
I mean, you know, what kind of calories is just as important, because, you know, some people say they're calorie deficient or deficit, sorry, but they're not eating enough protein, or it's like all carbs, or like I touched on earlier, those polyunsaturated fatty acids are very inflammatory, and they, you know, don't really let our mitochondria, which is the energy in our cells, it kind of blocks that system. So sometimes removing certain things from our diet can actually improve. We can eat the same amount of calories, but having the right calories can have a really, really big impact.
Yeah, it's going to make an impact on how those calories are sustained throughout a day as well, right?
Because sometimes, like, you know, those, again, I do touch on PUFAs a lot, but you know, they make us more hungry, so we can eat more, and we can eat the wrong stuff, like, you know, those carbohydrates or those sugar foods, because, you know, you go for the quick fix because you're hungry. So, you know, it's again really important for those macros. Those proteins in the morning are really important. Yeah,
and even to like a very practical sense of like, are you counting the juice? Are you counting the cream that you put in your coffee? Are you counting the handfuls of M&Ms that you grab when you walk past Cindy's desk every single time? Like, those types of things often go untracked and unnoticed. And oftentimes, like, I've even seen it before where people are waking up in the middle of the night and eating, and they have no recollection that they actually were eating during the night, because they were like sleepwalking or something. They're like, I don't know, like, why I'm not losing weight. And once you figure some of those things out, it can be like the light bulb, like you were talking about earlier, right? It's like, oh, I didn't realize those M&Ms. Yeah.
That's the ultimate poor sleep habits leading to increased weight gain. Getting up in the middle of the night with no recollection, eating a whole meal. That's next level.
Unless it's like and drinking alcohol.
Like
binge drinking in the middle of the night and forgetting about
we can explain your memory recall.
Maybe we should test for that genetic Alzheimer's again.
And the other, with the reverse diet, which I imagine is just pretty much getting on a good schedule, eating healthy stuff again.
Pretty much.
It's really important to realize that, like, B vitamins help support metabolism, like healthy eating. There's all sorts of antioxidants. You don't need to take it in a capsule. It's all in your fruits and vegetables. And these things are all things that are going to support your metabolism. And then you mentioned the mitochondria. There are things that sometimes your mitochondria, I see this a lot in women that are menopausal or postmenopausal. Now, we know about estrogen's effect on weight loss and gain and things like that, but sometimes you have to support the mitochondria. And so I believe that's why CoQ10 works well, or the more absorbable form is ubiquinol. But there are things that you can take that literally the mitochondria is going to use as a source to create more ATP. And so CoQ10 is one of those things.
Yeah. And like we always touch on, like anything else, you can take whatever you want to take to help support it. But if you're not actually like eating a healthy diet, like an overall healthy diet, you're going to be fighting a losing battle, I think, right? Yeah. Okay, let's jump to another question. So this one was for me, but I'm going to throw it to you guys as well. So it says, Kyle, how has your approach changed over the years since teaching the Kung Fu Club? So I think what they're referring to is when I took over the club for my instructor when he retired. How has my approach changed since I started teaching? And I'll ask you guys the same question in terms of like, since you started as a practitioner, how, if at all, has your approach changed? I would say my approach has changed in the sense of like, I've really shifted my mindset around teaching to like, I have to produce winners, I have to produce people who are enjoying, like I have to make this experience the best possible experience for them. And that goes like fitness, massage, whatever. It's like, I want to have people leave having had a good experience. And that to me matters more now than producing even like results with a client. Like sometimes clients walk out of your massage and they don't feel 100% better afterwards. And it's like, I used to really like get on myself about that. I'm like, oh, I should have done more. There's more I could have done. It's like, well, did they have a good experience? Like, did it actually help? Those types of things. So I'll throw that to you guys.
I can go ahead.
Yeah, go for it.
So for me, I haven't been in the massage field very long, but a little bit about my background is I have some education in nursing and I have education in nutrition as well. So I have that allopathic and like Eastern medicine type mindset. But for me, the way it's changed is I always wanted to like go in and I be the one to like help somebody. But it's changed because I want the person to be able to help themselves. So I really want to educate the person and make them feel comfortable in that, you know, it can be up to them and it's in their hands to change. And which to me, I hope that doesn't sound like a scary thing, but you know, we all have the power within ourselves to change, and it doesn't have to be super big and scary. It can be small incremental changes over time. But, you know, that's kind of my focus. And I really hope that that does come across in all of my practices that I choose to do. So,
yeah. Awesome.
Yeah.
Taylor?
Yeah, I think definitely mine has changed a little bit. I think the same kind of thing when I first started massage, I was like, oh, I have to fix everything. But it's also like how the patient is presenting that day. Like if they're a little bit lower, even emotionally, you have to take it easy a little bit. Like it's what they're giving you that day. And you just have to keep that in mind. Even if their pain is coming from like something more visceral, like there could be so many different things that are happening, and just slowing down and really listening to the patient and what they're presenting with.
Yeah, sounds like more client focused, less like therapist focused. Yeah. Dr. Riley?
Yeah, I like that. Listening more is always a good thing to include in your goals as a progressing practitioner, because the people that you're treating, they'll tell you so much if you allow them to, and instead of you creating all, you know, making all the connections with the dots, like sometimes they can do it for themselves, or they can really help you do it, so you're not guessing. But yeah, for me, I think it's allowing things to unfold with a little bit more patience. So I try to do that myself as a practitioner, that I'm only there's only so much I can do in that first hour I have with them. And when I first started, I wanted to impress everyone and I wanted to heal them in one session. Yeah. And it's like you give off weird energy when you're doing that.
or you gave them everything they needed.
They don't come back.
Yeah, maybe. So it's just being a little bit more patient, and then trying to promote that in the people I'm treating as well. It's like, you know, being more realistic with timelines and explaining that the body is resilient. Its set point is resilient, and it probably doesn't want to change. And there's good reasons why it shouldn't change after just a week. If everything in our body changed with such minimal input, we'd be more of a wreck than we already are. And so the body, it doesn't want to change that quickly. I think it's a really smart mechanism, and so things take time.
Yeah. Awesome. All right, one last question we got time for. Put you guys on the spot here. What separates you from other practitioners in your field?
Nothing.
That's so not true. You're the naturopathic ninja. Well, now you got to start.
I think that, like, and it's hard to say about separating myself from others. I just know that something that I am trying to continuously enact is humility, in combination with expertise. But I think that comes down to, well, like when you're humble, you're willing to continue to learn more throughout your career. You're willing to listen more to people. You're willing to go, maybe I got that diagnosis wrong, and I have to look into this again and like email this and change things, like, you know, right now, because I think I got that wrong, instead of things like I just kind of went through that with a patient that just got into their third trimester of pregnancy, and I thought I double checked everything, but there was one little detail so I think that I am a humble type of practitioner with expertise. And what you still don't see enough of in my line of work, I think, is just being humble enough to realize the things that we thought worked that have been discredited through good research, that we have to let go of, and hold on to the things that we got right, we know works, and carry that forward. And so with that humility, I'm willing to drop a few things that maybe I learned about previously that now doesn't really fit into my value systems.
Okay.
Yeah. And plus, you know, the mobile thing is pretty cool that we do.
Yep.
Yeah.
Absolutely.
Going into people's homes and doing appointments is, I don't know if there's any other NDs in the city that do it.
Yeah.
Kind of thing.
So. None that we know about, which is important.
Yeah.
Taylor, to you.
Okay. So I guess definitely what Dr. Riley said, definitely still learning. I'm moving more into the acupuncture and TCM side of things. So my mindset is a little bit changing, but I definitely see the value in soft tissue manipulation still. So I guess it's just kind of getting transitioned into TCM. So I'm definitely looking at the body as a whole more, which like organs, which are coming into play even with like your body pain. So just more internal things that are showing up externally and internally a little bit. So yeah, and I'm still learning in my 3rd year. So that's where my treatments are going.
It's cool when you are getting that different and new education and how you start to like maneuver that into your practice a little bit. And it is a big advantage for sure.
Yeah.
Cool. To Neil, to you.
Yeah, and touching on that, like it's when you start learning about, different fields and see how intertwined everything is, or it can be. So that's kind of where I come from too, is the nutritional side and now massage. There's a lot of just very similarities. And now through the massage practice, I can, kind of figure out, people ask me nutritional questions and stuff and, talk about their tissue health and everything like that. So I don't know, for me, I don't really know if I really stand apart, but I always try to look at the root cause, and always try and listen to the client, what they want. I go into sessions not trying to treat always. Sometimes people just want to lay on the table and relax, and you have to do that, give that for them.
Yeah, that's the number one thing that I was telling you before, is like, it's the number one thing I've heard from you, from clients that have seen you so far, is like, she listens like to everything that I need. Like she like doesn't miss a single thing that I asked for, kind of thing. Like I asked for my feet to be massaged and she did it, right? Not like that Kyle guy who doesn't want to touch anybody's feet. Yeah.
Without medical gloves on.
Yeah, without the medical gloves, yeah.
Well, I know how good that feels, so yeah.
Yeah.
I got the feet.
Yeah, no, that's good. For me, it would probably be, what separates me? Well, I think the martial arts piece that I have, and that bringing that into my practice and just like my personal experience through martial arts and that type of thing definitely differentiates me as well. But also just I've really changed over the years of like wanting to fix people, like we talked about before, to kind of what you touched on as well, to Neil, of like wanting to empower people, wanting to give people those tools. And I think that's something that is lacking, especially in like the fitness and nutrition, where it's such an industry of selling, which, yes, we want to do these things. We need to have a successful business and stuff like that. But we want to see, what we really want to see is start to make changes in the world and how people are, and whether that's massage therapy or fitness or nutrition or naturopathic medicine. That's kind of what we're all about, right? It's just like trying to make people better and give people those tools. So.
Well, and touching on that, like, and that will go down hopefully into the families, because if we can empower the parent or whoever, the son, daughter, whoever it is, that can go generationally. So, it's,
Yeah, I like it. Healing trauma through generations as well.
Right?
It's going to have that big downstream effect.
Absolutely. Awesome. Well, that's all the questions we have time for. This was fun. Thank you guys for coming on the show. This is so cool. This is like
good energy, good vibes today. I loved it. Yeah. I've
been wanting to do this one for a while, getting the whole team together. And it's so cool to see that, people think like massage therapist or naturopathic doctor or, fitness guy or whatever. Like we often get labeled as like one thing. So it's really cool to hear from everybody and to give everybody an opportunity to really demonstrate how it's, it's not just massage. It's not just nutrition. It's not just naturopathic medicine. It's a very holistic thing. And using all these different practices together is really the trifecta.
Yeah.
Awesome. Well, thank you guys for being here. And thank you to our audience for listening and watching. And we'll see you in the next episode. For additional support or to work with one of us one-on-one, go to our website, www.wellnessdojo.ca. You can also find us on Instagram at Wellness Dojo YYC, or on all other social media platforms searching The Wellness Dojo. We'll see you in the next episode.